It is said that blood is the red gold in time of saving a life. Dating back to World War I, when blood transfusions were first used to save the lives of wounded soldiers, donating blood in public places soon became a duty for citizens to enroll into saving someone's life. Human blood is a rare part of our body that only we can produce within ourselves, and if someone is in need in search for blood that can save their life, they know that someone has donated theirs to save them. This year has been the highest drop in blood donations, causing major blood shortages in hospitals and blood banks. When a blood shortage is low, important surgeries or other procedures have to be put on hold or canceled because physicians don't have the supplies they need for the procedure to go smoothly. The effects of having a blood shortage would cost not only supplies at a hospital, but possibly the life of a patient with a life-threatening disease. This would cause fear to the patient's families as well as the patient themselves, knowing that there was not enough blood that could save their life when the time came. Shortage on blood affects patients that are already in the hospital, but what about the people who get in emergency situations and donated blood is the only thing that can save their life? People who are involved in any kind of accident and are severely injured or has major blood loss, the first point of attack to save their life is blood that someone can donate. There are certain parts of the blood that can be used to serve certain purposes. Specialists separate these different parts of the blood cells to save someone's life when the time is needed. After interviewing Miss Peggy from the Western Kentucky Regional Blood Center, she shared the knowledge of the separation of the cells.
Here, we divided into three components, which is red cells, and then which they last 42 days. They have to be refrigerated. Then we take the plasma off the blood, which it can be frozen up to a year, so it's thawed out, you have to use it. And then platelets, which is your clotting, they have to stay room temperature. You put them on a shaker or something so that once they stick together, they worked. And they last 5 days, so we constantly need platelets, especially for cancer patients like the heart, all that. And we just take platelets off people. I don't still separate it.
Transfusions are a rescue for ill patients. A blood transfusion is a safe, common procedure in which blood is given to you through an IV line in one of your blood vessels. Blood transfusions are done to replace blood loss during surgery or due to a serious injury. A transfusion also may be done if your body can't make blood properly because of an illness. Transfusions are a superhero of medicine for many patients, but with great things come risk. Transfusions' risk level has risen with the knowledge that medical professionals have reached with blood-transmitted diseases. The biggest risk taken when given a transfusion is that of an infection. The blood could be contaminated or not screened properly and could lead to serious harm of the patient if blood is given to them. Not only is infection a risk, but so is blood-transmitted diseases. A sample of blood that is contaminated can go through screening and not get noticed because these diseases don't develop till 7 to 10 days after contact. But this source of saving someone's life is the best and fastest way to do so. Coming with new technology comes the nucleic acid testing. It can detect the amount of actual virus in the bloodstream, not just the antibodies produced to fight it. Every ounce of donated blood is now screened tested before going into any blood bank. Blood banks collect, test, and store blood. They carefully screen all donated blood for possible infectious agents such as viruses that could make you sick. Each sample of blood is tested for at least 8 diseases before sent off. Blood is the most precious gift that anyone can give to another person, the gift of life. A decision to donate your blood can save a life or even several. Donating blood has brought a new light to itself for having people donate. Donating blood saves millions of lives every day, but the problems that are rising with blood donation are getting more and more serious. It's time to find a solution for all the problems and focus on saving lives by blood.